Hi, my name's Mike Melnick. You may know me from the radio. I'm here today to introduce your featured speaker, Dr. Ed Jindrich, or simply Dr. Ed as he's known. Today, Dr. Ed will be sharing with you a principle of health and healing that is easy to understand and very powerful in dealing with pain and many diseases. It's a principle that requires no drugs or surgery. Listen carefully, and you will be amazed. I know I was the first time I heard it.
Thanks, Mike. I've been in practice for over 13 years, and one thing that I'm seeing on a consistent basis is that pain and chronic disease is on a real upswing right now. And along with that, too, is the use of prescription over-counter medications. Again, record levels every single year in the last 5 years. So what's going on? Is there more help for me than just a pill? Well, I'm here to tell you that there is. I'm going to share with you today the most amazing principle in health and healing that I know. It's a principle that once you understand and apply it, it will change your life and the lives of your family forever. Now, before we get into this principle of health and healing, I want to first share with you the true definition of health. Because most people perceive health as merely how they are feeling. However, when you look at the top 2 killers in our country right now, being cancer and heart disease, which is killing 5 out of every 6 of us, both those diseases, we know many people who have died from those diseases who felt great the day before and suddenly passed away. So there's something more to health than just merely how we're feeling. Even the World Health Organization defines health as optimal physical, mental, and social well-being, not just merely the absence of infirmity or disease. So how can you increase function at a natural level? Well, the acronym that we use for this is the word DREAM. D stands for diet, R stands for rest, E stands for exercise, A for attitudes, and M, maintenance of the nerve system. The first 4, most of us are very well versed in. However, what I find is that many people are unaware of the 5th one. Maintenance of the nerve system is the key. When you look at the nerve system is headed up by one organ. It's the organ that controls everything in our bodies. And most of us know what that is. That is the brain. And it controls everything there. It controls your muscle movement of your legs. It controls how much hormone your thyroid is going to produce. It controls how often your heart's going to beat. It controls your blood pressure. It controls over 2 to 3 million chemical reactions simultaneously among 75 trillion cells. Now, your nerve system has basically 2 functions. Number 1, to animate its parts, and number 2, it's also responsible for all the healing that takes place in your body. Now, looking at the nerve system is made up of 3 parts, being the brain, the spinal cord, and the nerves. And they're actually all one piece. So really how this works is very, very simple to understand. Information is constantly being passed from the brain, down the spinal cord, and out the nerve to particular organs. And it's a 2-way communication system between brain and organs. So the information is constantly going back and forth. So it'll go from the brain, down the spinal cord, and out to the bowel, and also from the bowel back to the nerve system, back into the brain. If this information, if this power that, by the way, travels at over 240 kilometers an hour, if that power is coming through the nerve system, down the spinal cord, and out the nerve at 100%, we would have 100% function of that organ. That organ would function at 100% and it would be able to heal itself at 100% as well. Now, looking at it from the converse side, if we went in here and we severed the nerve, what do you think would happen with the function of the organ? It wouldn't slow down, it would die. So 100% information, 100% function and healing. Now, obviously, it doesn't happen very often that somebody be in your body severing nerves. But unfortunately, what does happen is the spine sometimes gets in the way of the transmission of that power through the nerve system. You have to understand that your spine is made up of 24 movable segments. It is what allows you to bend and twist. Now, when I show you this vertebrae shifting out of its position, what happens here is the bony side of the hole starts to close down and it starts to choke off the nerve flow. This process here is called a subluxation. Now, when I show this to you, what's the first thing that comes to your mind? What symptom? Pain. Now, this is one of the key facts, is that only 7% of this nerve carries pain messages. Only 7%. That means if the nerve is being pinched from the other 93%, you will not feel any pain. Understanding that less than 10% of your nerve system conveys pain messages, the other 90% is used to run all this amazing hardware over here. Which again brings us to another bizarre point. Most of these organs have no pain-sensitive fibers in them. How often have you heard somebody say, boy, my spleen is just killing me today? Or my kidney's just been irritating me since Tuesday. You just don't hear these things because these organs, for the large part, have no pain-sensitive fibers in them. So how do we know that they're functioning properly? Hard to tell. We now have technology that actually measures the nerve flow from the brain to all these organs, so we can see and map out exactly what kind of nerve flow we're getting to these organs, what kind of communication is between the brain and its parts. Because the better the communication you have, the better health, function, and healing capacity you also have too. Three causes to a subluxation: physical stress, chemical stress, or emotional stress. Physical stress is a big one. Physical stress can come in many forms. Even the birth process itself, right off the bat, many times causes a lot of stress to the upper neck. There's a lot of pounds per square inch of force being used to, again, extract the child from its mom. So we see a lot of infants in the office, even a few days old, that are already subluxated with their upper necks just, again, twisted out of position. Many times that results in colic, ear infections, even learning disabilities such as ADHD and a variety of other things as well. We've seen tremendous results with these types of problems. Ear infections, for one, we see constantly patients that are coming in with their kids who have been on multiple antibiotics. And after a course of care, we see those ear infections totally clear up. Some other physical causes to subluxation would be such things as poor posture. Certainly we see it a lot of times with our kids at school, or even us when we're at the computer, 40 hours a week hunched over. Could be poor lifting, could be an accident, a motor vehicle trauma. All these types of things that most of us have gone through has knocked our spine around, causing these subluxations. In my experience, the majority of the population has already developed subluxation way before they're even an adult, for that matter. I want to show you the distribution of the nerve system. When you're looking at the spine, the lower 5 vertebrae supply most of the nerves down into the legs, but they also supply the pelvic organs: bowel, bladder, menstrual organs, prostate. So when people are subluxated in this part of their spine, many times they'll have pains in their legs or numbness or tingling. But that's not always the case. Again, remember, only 7% of the nerve system conveys pain messages. The other 93% again are supporting those organs that we just mentioned. So with subluxation of the lower spine, you will many times see women with menstrual problems. They have irregularity, menstrual cramping, again, very common thing we see in the office. Also bladder problems and prostate too. All those areas again are involved when the nerves are not functioning properly from the lower spine. Looking at the nerves from the neck, they supply two major areas: the arms and also the structures back in the head. So when there's a subluxation present in that part of your spine, many times patients will have symptoms in their arms, but they can also have symptoms with their eyes, ears, nose, sinuses, headaches, dizziness. Again, headaches we just see so commonly out there. So many people suffering from headaches. And it's one of the symptoms we see the absolute greatest results with. In fact, one of the reasons that I consulted a chiropractor in my teens for the first time was for migraine headaches. I suffered from horrible migraines that would last for 2 or 3 days. I would be just absolutely down and out. Chiropractic has completely taken those away. It's been a miracle for me and hundreds of other patients as well. It is not a treatment for lower back pain. I know a lot of you right now are probably surprised by me saying that. But it's also not a treatment for neck pain, headaches, or anything else. It is merely, again, the correction and detection of subluxation. Because when we are effective in removing the stress off that nerve system, your body starts a healing process. You must understand that healing does not begin from outside the body. It begins within the body. In fact, a real basic definition of healing is the body replacing damaged or dead cells with new cells. The only ones capable of doing that is you. How do you do that? By the brain properly communicating with all its parts. So if the area that's under attack, that's dysfunctioning or diseased, and it's not functioning properly, the only way that the body can heal itself is by the brain fully communicating with that organ, allowing that organ to restore normal cells by replacing the damaged and dead cells with new cells and restoring normal function of that organ. That's how your body heals itself. Looking at Charlie here, looking at him from the side, there should be curves. And these pointy parts are what you feel when you run your hands down your spine. So Charlie's facing that direction there. When we're looking at the spine from behind, most of us already know that the spine should be straight. We don't want to have any curves in there. That in itself is also a concern to the spinal cord nerve function. But looking at the spine from the side, this is really the most important part. Your spine should have 3 curves, one in the lower back, one in the mid-back, and a third one in the neck. So the curve or arc of the lower spine should be 35 degrees. In the neck, the curve should be 45 degrees. The reason that the neck is the most important part of your spine is that all the information from the brain that runs through the spinal cord must first pass through the cord here before it goes to your throat, through the cord here before it goes to your heart, through the cord here before it goes down into your bowels and bladder and feet. So that's why the neck is the most important. The unfortunate example of this is Christopher Reeve. Here's the guy that ironically plays Superman. He's riding his horse one day, falls off his horse, fractured the second bone in his neck, and severed 4/5 of his spinal cord. Immediately he lost function of the majority of the organs in his body because they were disconnected from what? The brain. Now, that's why, again, the neck is referred to as the arc of life, because, again, of its massive importance. Unfortunately, the neck is the most commonly subluxated part of the human spine, mostly because it's the most mobile. And a good example of this is if a person goes through a car accident, which part of their spine typically suffers the most amount of damage? Their neck. Even though their entire spine went through the accident, it's the neck that really, again, takes the brunt of the damage. Now, looking at the spine, when that curve is there, then the weight of the head, which is anywhere from 8 to 10 pounds, loads onto the joints back here, and it saves the discs. And the spinal cord that sits back here is in a nice relaxed position. Think of the spinal cord as looking at your hand. So you take your hand and straighten it out, you can see what happens to the skin on the inside part of your hand. It stretches. So if that spinal cord stretches, do you think that's going to increase or decrease the amount of messages traveling from the brain to the rest of the body? Decrease. And so again, it's imperative that we have that full curve in there. Now, the worst thing you could ever see on an x-ray of a neck is a neck that's in what we call a reverse curve. Now, in a reverse curve, you can see what's really happening to that spinal cord. If you take your fingers, and don't do this, I'm a trained professional, but if you take your hand and you actually put it into a reverse curve, you can see your skin gets very, very tight. Well, that's the same thing that happens to that spinal cord. Research has shown that when the curve in the neck is lost, and you've lost the curve, let's call this a 0-degree curve, that even at a 0-degree curve, the spinal cord is being stretched 3/4 of an inch. With the spinal cord being stretched 3/4 of an inch, the capacity of that cord to carry information from the brain to the rest of the body is reduced by 25%. That is staggering. And for people who are in a reverse curve, you can see the kind of massive damage that's going to occur to the spinal cord. You are significantly choking off the information from the brain to the rest of the body. That's why the reverse curve is the worst thing you can see on x-ray. Over here, we're looking at 2 vertebrae and discs that are perfectly aligned, no subluxation present. In this model here, this is a subluxation that's about 5 years old. This is a subluxation that's about 20 years old, and this is one that's 40 years old. Again, much the same as a tired of alignment. Left that way, it continues to deteriorate further and further. So the primary concern of these subluxations is the neurological effect. But the secondary concern is the effect that it has on the vertebrae and discs. When the spine is in its curved position, the weight of the head locks down these joints and it spares the front part of the spine. This is how the spine is supposed to be. If, however, that curve is lost, and now the weight of the head is now transferred to the front part of the spine, the discs and vertebrae begin to deteriorate. This is better known as osteoarthritis. And osteoarthritis is a decay of vertebrae and discs. That in turn will start putting more pressure on the spinal cord and nerves. This is why people who suffer from this arthritis have a lot of pain and other neurological and disease issues because their nerve system is so compromised as a result of the decay that's occurred in their spine. Chiropractic has had many advancements in the correction of subluxation. And these advancements have really excelled what we can do with the spine and how much faster that spine can be treated. Is it an overnight process? No, it's not. It does take time. It took a while for this patient to be sick. It's going to take some time for that patient to be well. But the spine can be so much more restored now than even 10, 20 years ago. The technology has increased considerably. If these vertebrae are supposed to be aligned one on top of another and the nerve is over here, everything's going to work the way it's supposed to. Your spine will be nice and flexible, there'll be no pain, and your nerve system is conveying maximum information to its parts. If that vertebrae slips out of its position, it starts to compress the nerve. This is where we come in. Through a series of small adjustments, we start to bring that vertebrae back to its proper position. Two things will occur. First of all, we'll remove the nerve interference over here, but secondly, like realigning that tire, we are now reversing the damage that's occurred to that spine and bringing that spine back to its proper position. Firstly, preventing any more deterioration from occurring, and even in many cases, you'll actually see some of those discs start to thicken back up because those stresses are off the discs. So through chiropractic care, we have the ability not just to correct the actual subluxation, the rotation of vertebrae, but to also make postural changes as well. It's a very simple method. It's one that the patient can do at home, but really helps their care along much, much quicker so that we can get the results necessary. Not that the patient is just feeling well, but the spine is properly structured back to its proper curves, therefore preventing the further chance of having any arthritic process set into the spine. Many of you have heard some of the miraculous results that chiropractic care produces, and I want to share with you quite simply why. Let's look at the lower back, for example. When the nerves of the lower back are being irritated or pinched, yes, they can cause pain down into the leg, but they're also going to affect the organ function in that area. Bowel, bladder, menstrual organs may be affected. Let's say the woman's experiencing severe menstrual cramping. It is impossible for me to take the pressure off the nerve traveling down into the leg and not have an effect on the nerve that's traveling to the menstrual organ, because it's the same nerve. So when you look at that nerve like a fiber optics cable, it has millions of fibers running through it, and only maybe the bottom section has pain. So if you compress the nerve from the bottom part, you will experience pain. But if you compress the nerve from the top part, you will not feel any pain. So if this lady comes to us and she has sciatic pain and menstrual cramping, and we take the stress off the nerve, the entire nerve's going to function better. Therefore, menstrual organs will function better, and her leg pain will go away as well. When a patient tells me about pain or numbness or tingling running in the arm, that becomes very concerning to me. Not just because the symptoms are experienced in the arm, but also where else is that nerve going? Well, the nerves that travel down into your arm are also the nerves that supply your heart. So if the person's arm isn't functioning properly, chances are their heart isn't functioning properly as well. How many times have you heard of somebody suffering a heart attack? How did they know they had the heart attack? Because they had pain where? In the arm, which again tells us the connection there. So just like we mentioned the scenario here with the nerves traveling down into the leg and into the menstrual organs, same thing here with the lower part of the neck here, where the nerves travel not only down the arm, but also to the heart as well. If you are someone who's currently under chiropractic care, it is my sincere hope that we've deepened your appreciation for the service that you're being provided. If, however, you are someone who's looking for answers to your pain or problem, we'd love to have a look at you. Just call the number on the screen. The customary fee for a complete exam of your spine and nerve system is typically anywhere from $85 to $125. In an effort to reduce financial barriers, we've reduced that cost down to $35. And as usual, we donate 20 of that to the United Way. The other thing that we also provide for all our patients is what we call a service guarantee. And that is simply this. For a patient who's wondering, is chiropractic care really something that's going to suit me? I don't want to spend a lot of time and money finding that out. Our service guarantee simply states this, that you have 12 adjustments to see if you belong in our office. If at the end of those 12 adjustments, for any reason, you feel that you're not satisfied with the service that you're being provided, I will personally refund all the money you've paid for those first 12 adjustments. That's a guarantee that I give you and I've given to all our patients, because we want to make sure that you are happy where you're at. What do you have to lose other than the pain? Thank you, and God bless.